Hey nurses, it is Monday, so I am checking in on how you are studying. We are going to do part 2 of the VT homework review. If you are into my NCLEX review program, then you know homework is a big part of preparing for NCLEX. So you have your quick facts for NCLEX. I know you're studying it, making tabs on it. We went over how you should be studying this. Now is the time to talk about the lectures. Lectures over questions, content over questions. I say that all the time. So part 1, we look at basic care and comfort homework. We're going to go back to page 60 in the RN workbook because I want to finish these questions. There were a lot of questions that we didn't cover, and so I want to go back over them. So if you are studying, this should be your process to help you prepare for this exam better. Don't do the random questions. Don't sit down and open up this book and kind of just be like, oh, fall into what you're going to do. Have an actual plan. Have an actual plan. And so the study calendar gives you that plan. You just have to follow it. You just have to follow it. You guys are a very special group of nurses, and I want for you to have the best possible outcome when you take this test, because nobody wants to pay for this test 2 and 3 and 4 times just because they missed out on a fundamental step of preparation. So we're going to go back to page 60 and remember reading the directions at the top of the VT. It's very important. You are going to do your workbook homework before you go into the virtual trainer and answer the questions. So all of your notes, and this is the benefit of having this workbook. You can put all of your notes down. You can make marks and check boxes. You can't do that if you're just studying from a computer screen. So use this to your advantage. All right. Everything should be for your good here. So we're going to pick up on question number 5. Question number 5. And it says here, just try to give me the answer. I'm going to read it, but here goes. Here's question number 5. Mr. Jones, okay, before I start this question, you can find your study calendar in the file vault of your virtual trainer. That is where your study calendar is. It's the file vault. And it doesn't matter. We're doing the RN homework, but if you're a PN, you also have a study calendar too in your file vault, okay? Okay. So question number 5 says this. Let me know what you guys think. Mr. Jones, a 60-year-old post-op client, has his door closed. Mr. Jones, 60 years old, post-op, he has his door closed. The registered nurse needs to take a set of vital signs, okay? What should she do? Here are the options. A, knock on the door and wait for the client to respond. B, come back in 10 minutes. C, open the door immediately, as doors should not be closed. Or D, knock and enter without waiting for the client to respond. Okay? What do you guys think? A client has his door closed. Okay? The nurse needs to go in to take vital signs, but the door is closed. You walk up, you got your cart, you walk up to the door, and it is closed. What should the nurse do? Should she A, knock and wait for the client to respond? I'm on page 60. B, come back in 10 minutes because the door is closed. C, open the door immediately. Doors should not be closed in hospitals. Open the door immediately. Or D, knock and enter in without waiting for a response in case the patient is in danger. All right. What do you guys think? And I see the answers coming in, a lot of A's, a lot of D's. So you get it down to 2. Which one is right? And this is the benefit of the homework. People ask me all the time, does the VT have questions? Yes, the VT has plenty of questions in the homework, in the progress exams. So this is a critical thinking question. The correct answer actually is A. It actually is A. The registered nurse should knock and wait for the client to respond. And this is something that's very important under client rights. When a client comes into the hospital, guess what? They pay for that room. That is their room. That is their temporary home. So if the door is closed, you don't just bust in there talking about, I'm taking vital signs right now. That's not what NCLEX wants you to do at all. They want you to knock on the door and wait for the client to respond, to say, yes, you can come in. I'm decent. I'll allow you in there. All right. A lot of nurses in the real world, y'all know, we just bust in. We don't wait for the client to respond. And so although it's happening in the real world, it's not appropriate for the NCLEX world. All right. So if you got that one wrong, just go ahead and you can put a mark by it and review it again. All right. Or just study it, make a flashcard, whatever you want to do. That's how you use this homework. We are moving on. I'm on page 61 now of the RN homework, and it says this: which vitamin is most effective in preventing neural tube defects? Which vitamin is most effective in preventing neural tube defects? Is it A, vitamin D, B, vitamin C, niacin, or D, folic acid? Neural tube defects, which vitamin do you care about? Is it vitamin D, vitamin C, niacin, or folic acid? Which one? Okay. And remember, we talked about neural tube defects in the pediatric review. All right. In the pediatric review, we talked about it. So what would you see for a neural tube defect is, something that babies are born with. Okay, babies are born with. So we talked about spina bifida, right? So which vitamin is going to be most important in preventing that? Vitamin D, vitamin C, niacin. Do you know what niacin is for? Or folic acid? Good job. Come on in. We are live. This is Monday. I'm checking on you this Monday, as I always do. But here, the correct answer is actually going to be, do you have it? Most of you have it. Have it in my book here. D, folic acid. Absolutely the most essential. All right. And it's just a major point you got to know. Okay, here we go. I'm moving on. I want to do, let's see. Let's skip down to number 9. I like this question a lot. You ready? Okay. At which age will a child not receive the DTaP immunization if started on a regular schedule? Okay. DTaP immunization. At which age will a child not receive it if started on a regular schedule? So is it A, birth, B, 2 months, C, 4 months, or D, 6 months? Okay, and so for this, we're talking about immunizations here. So I know that we also go over immunizations in quick facts. So hold on. So if I'm doing the homework and I come across a question that I'm not really sure about, I can go to quick facts and see if it's something that's covered. And immunizations is covered in this book. So I'm going to turn to page, and again, this is how you do the homework. You are looking up the information. This is not a progress exam where you are just trying to see where you're at. No, you're working the homework. You work the homework. So here in quick facts is immunizations. So because we're talking about the DTaP, I can see everywhere that the DTaP is given, and I'm looking for where it's not given. Okay, I'm looking for where it's not given. So here I see that DTaP is given from the choices 2, 4, and 6 months. And this is why I love this book, because it's straight to the point. You ain't got to read no long paragraphs to figure out what's important for NCLEX. This is quick facts for NCLEX. This is not the entire story of nursing, okay? So if I just look at this book, I have the answer. And so if I go back here, then I know the correct answer for page 61, let me get to it, is going to be A, birth. We don't give the DTaP immunizations at birth. And this is a great point, because your NCLEX exam is going to ask you all types of questions, and they're going to be from different sections. So you may get a question like we just got about neural tube defects. The next one might be about the immunization schedule. You have to be able to go from one point to the next point. All right. So if you don't have this package and you want to sign up for it, go to remarnurse.com, and that is where you can get started preparing for NCLEX the right way. All right. Vivian, shout out to Vivian. I love this comment. She says, Regina, I passed NCLEX in 3 weeks with the quick facts and virtual trainer. Well, my goodness, you have done something so fantastic. 3 weeks. My program is 6 weeks. How did you do it in 3 weeks? How? Tell me how. All right. That's just amazing. You guys, you blow me away sometimes. You really do. Okay. All right. Question. So that was question number 9. The correct answer is A. You can find that on Quick Facts, page 31. And look, I wrote that down for myself in the homework. I just put Quick Facts, page 31. So when you're going through the homework, make notes. It really helps. Okay. All right. Okay. Here we go. So much stuff. Here's the question. Are they changing NCLEX the next year? This is a good question, Linda. Are they changing NCLEX in 2022? No, they will not be changing NCLEX in 2022. They will be changing it in 2023. So if you are a nursing student and you graduate next year, don't wait to take it. If you are a nursing student and you can take it tomorrow, take it as soon as possible. Take it as soon as possible, all right? Because when they change that exam, we think what we're studying for now is hard. It's going to be even more challenging. But don't worry. If you do have to take it, I will be there every step of the way helping you, all right? Okay, so next question is this. This is question number 11, which is the priority nursing intervention in the immediate phase after a seizure? Okay. What is the priority nursing intervention in the immediate phase after a seizure? And you guys should already be thinking in your minds, I know what that is. I know as a nurse what I'm supposed to be doing, but let me give you the options. A, assess the client's breathing pattern. B, position the client comfortably. C, assess the client vital signs. D, reorient the client to time, person, and place. So if we're talking about immediately after a seizure, what is the most important thing to do? You guys know, and if you don't know about seizures, you can write notes about it. What is a seizure? What happens during a seizure? There's different types of seizures. You guys know there's 2 different types of seizures. You got to know about them. Does the patient lose consciousness, or are they awake the whole time? Do they know what's going on? Keisha, shout out. She's a ReMar nurse showing up for Monday motivation. So after a seizure, what's going on? Are you going to A, assess the client's breathing pattern? B, are we positioning the client comfortably? C, assess the vital signs. Or D, reorient the patient. What is going to be the priority? And remember, the thing about, I shout out to Robert, you got the answer right. You are so awesome. I see it. The thing about NCLEX is that all the options will make sense. All the options could be correct, but you got to know what to do first, because the correct answer here is assess the client's breathing patterns. You know, if you can't breathe, it doesn't matter what position you're in. It doesn't matter how many pillows you have behind your bed, how comfortable you are. It doesn't matter what your vital signs are. If you have a perfect blood pressure, if you can't breathe, then nothing else matters, because some students might get confused with checking the vital signs or assessing the breathing pattern. But remember, you can check the person's vital signs and say somebody has an off blood pressure or an off temperature, right? Or an off pulse. You're going to live a lot longer if your blood pressure is high than if you can't breathe, okay? So if your blood pressure is high, how long can you live? You can live hours, days, weeks. How many people walking around with silent hypertension don't know that they have high blood pressure? Don't know for years, and you're just walking around, right? But if you can't breathe, how long do you have to live? Are you just walking around not knowing that you can't breathe? No, you definitely know. So you have about 6 minutes before you begin to go brain dead. All right. So that airway is always going to be over circulation. And it doesn't matter how NCLEX spins it. If they say shortness of breath, if they say airway, and then they do circulation and say a patient is hemorrhaging, hemorrhaging is never over airway. Vital signs are never over airway, okay? So I hope that makes sense to you guys. We are going to be let's do question number 14. This actually is a topic that we go over in the lectures. It says this, 6 minutes. Yes, 6 minutes. That's all you have. So airway is always going to be the priority, honestly. Okay, the mother of a 2-year-old asked the nurse how to cope with frequent temper tantrums. We know 2-year-olds have frequent temper tantrums. What information should the nurse include when responding? What is our appropriate answer to temper tantrums? Okay. So appropriate answer to temper tantrums. And no, Sharina, that's a very good question. Just going back, she says, so respiration is not included in vital signs. Respiration is definitely included in vital signs. But when NCLEX is asking you, 2 options you have here: assess the client's breathing pattern or assess the client's vital signs. What is going to be the priority from them too? It's going to be the breathing pattern, all right? Because the vital signs means you're going to get the blood pressure, you're going to get the temperature, you're going to get the pulse, right? You're going to get the respiration rate, you're going to get the pain. That is not the priority. The airway, the breathing pattern alone is going to be the priority. Okay, so I'm going back. How do we deal with temper tantrums from 2-year-olds? I know some kids who are over 2, they're still having temper tantrums. What do we tell the mother? So A, spank the child. A, spank the child gently. B, explain to the child why their behavior is wrong. 2-year-old temper tantrum. Are we going to spank them? Are we going to explain why their behavior is wrong? C, ignore the child as long as they are safe. D, give the child a delicious snack. What is the right answer here? I'm on page 62 of the homework. How do we deal with temper tantrums from 2-year-olds? They have them when they don't get what they want. They're not getting what they want, and so they throw a tantrum. What should the nurse say? Should she tell the mother? A, spank the child gently. B, explain to the child why their behavior is wrong. C, ignore the child as long as they are safe. Or D, give the child a delicious snack. Let me see what I have on the screen here. I have lots of C's. Okay, nobody old school picked A. Spank the child. All right, so for the NCLEX exam, we know that when it comes to temper tantrums, it's considered normal, and it is expected. And so the appropriate response to a temper tantrum is to ignore the child here from the choices that we're given. Remember, when you're taking this test, I don't want you to waste any time sitting there thinking, oh, I wish it would have said, put the child in timeout for 2 minutes. Why didn't it say that? Because when you do that on the exam, not only are you wasting time, but it is not contributing to your success rate at all. Okay? It's not contributing to your success rate. You can't be there saying, oh, if it said this, then I know I would have known it. I know I would get it right. Why didn't it say this? This is what I studied. No, NCLEX is about looking at what's in front of you and picking the best options from what they give you. It's their test. They wrote it. It's not your test. Don't waste time wishing that it said something that it doesn't say. So from the options that we're given, we have to pick ignore the child if they are safe, because the other ones don't make sense. I mean, we know A says to spank the child. We're not going to be spanking the child for NCLEX. Now, what you do at home is different. And then B sounds good explaining to the child why their behavior is wrong. But if you have a 2-year-old, are you going to be able to say, Johnny, this is not appropriate right now because we are in a public situation and I don't have the means to purchase this toy. It is, there are more priorities. You got a 2-year-old. They are not going to hear your explanations and you're going to look quite silly. So what you do is you're going to ignore this child. All right. It's the same as putting them in timeout. When they're in timeout, they're away from everybody else. They're not getting attention. 2-year-olds are doing this all for attention. Okay. 2-year-olds are doing this all for attention. And then D says, give the child a delicious snack. Definitely don't get caught up in that cycle because that's showing that Johnny would get the message. You can't be like, okay, Johnny, here's the brownies that you wanted all day, even though it's 9 o'clock in the morning. Here you go, because I don't want you to do this and embarrass me in public. All right. So getting a positive reward for a negative behavior, we don't ever do that either. You're not going to do that because that's only going to perpetuate this behavior. So the correct answer again is C. It's ignore the child as long as they are safe. And studying should be fun. You should be able to talk your way through the information. This should not be a source of stress for you because it's real life. It's really what NCLEX is about, is keeping you from killing somebody. We have public safety in our hands. And so we have to be able to really relate to it on a real life basis. Okay. All right. So let's do this question again. And this is basic care and comfort homework, but you can see that there are so many questions that you can write from just this topic. Okay. All right. So yes. And if you choose to spank your child, that's between you and the Lord. All right. And that, because if you're a Bible believing Christian, that the Bible says you spare the rod, you spoil the child. But for the purposes of this one-day exam, you got to go by what they're doing in the culture. All right. So here we go. A school nurse is orienting a school nurse. Happy birthday, Kenyatta. Happy birthday. We are praying for you. Thanks for joining in. Okay. A school nurse is orienting parents to the daycare unit. All right. A parent asks the nurse, when is an infant's first word? Okay. Parents ask the nurse, when is my baby supposed to be talking? All right. What's the correct answer? A, by 10 months. B, 11 to 13 months. C, 15 to 16 months. Or D, 26 months. Okay. All right. Which one are we going to say? And remember, when it comes to developmental milestones, you got to play it safe. Okay. This is the homework I'm doing from the VT student workbook, basic care and comfort homework. I am talking about question number 16 on page 62. So we have A, by 10 months, should the infant be talking? B, 11 to 13 months. So that's like 11 months to about a year or so, a little bit over a year. C, 15 to 16 months. Or D, after 26 months. After 26 months, that's over 2 years. All right, so NCLEX can give you months or they can give you days. Not days, they won't give you days, months or years. So the correct answer here, I see B. A lot of people are picking B. And that, of course, did anybody pick anything different? So many people picked A, by 10 months. All right. The correct answer is B, 11 to 13 months. So right about the year mark, you see babies talking. Now, can some babies talk before the year mark? Absolutely. There are some savant babies that are saying 3 and 4 words by the time they get to 11 months. Usually girls are more verbal than the boys. However, if you are talking to a concerned parent, that's not the information you want to give them. You don't want to say by 10 months, your baby should be talking. because mine was talking, or because I know so-and-so's baby started talking. You don't do that, because that causes the parents to have anxiety, thinking, what's wrong with my kid? Let's say how old the baby was in here. No, what's wrong with my kid at 10 months? They're not saying anything. So with developmental milestones, you want to give more time. You want to be more generous. So yes, 12 months, a year. You tell parents a year. Don't press them. They'll talk. And there's so many factors when a kid will talk. Are they the first child? Are they the third child? My third child right now, she's 10 months. She's walking. So, and it's because she sees other kids. Are you guys like that, where your second child develops faster than maybe the first, or the third child develops faster because they're around small people like themselves? But I would never tell a worried parent that my child is walking at 10 months, yours should be walking too. No, you give them more time. Okay. All right. So here we go. Let's do another one, right? All right. Question number 18. And we're just moving through the homework. Remember, you get to do this on your leisure at your pace. Typically, I would say it takes about an hour. So you can do this whenever, if you want to do it in the morning or if you want to do it in the evening. But this is part of the homework. This is part of the process. This is part of the training. You don't get to train lightly and then win. You guys know, when you talk about the top athletes in the world, they are literally training hard. They're literally spending hours and hours to do one performance. These Olympic players that played in the Olympics, they train for how long? 4 years to run one race. Okay, so what are we complaining about? If we study for 6 weeks, we can take one test that will change our lives forever. Forever. We can do this. You can do this. Okay. Next question is this. Which of the following is a stage of cognitive development according to Piaget? Okay. And Piaget, you guys know, he has a theory about age groups and what way of thinking they are. So is it A, hypothetical? Okay, which one is a stage? Okay, A, hypothetical, B, preoperational, C, fictional, D, conceptual, or E, sensory physical. So you have to have these stages memorized. If you don't, guess what? I wrote my notes here. This is also in Quick Facts. So this is one of the topics that is so important that I put it in both books, okay? And this is why it's good to have both books together. If you're just studying with Quick Facts to pass NCLEX, you're missing out on a whole lot. You are not doing ReMar review. Don't say you're doing ReMar review if you just have Quick Facts. You really need to have both. So I'm going to go in here. What page did I say it was on? Oh, bless it. Let's see. Okay, here it is. It's on page 50. All right, and so page 50 has Piaget's theory of cognitive development. So all I have to do is look at my homework and look at the choices that I'm given here, and I can find the answers here. And so the one that I know that is a option is going to be B, pre-operational. Pre-operational. Are you doing your homework? Are you researching? Because if you just didn't know these all together, if you're like, I have no idea, it's not good to just guess. It's better to stop, write them down. You know, you can look at them in the Quick Facts book. You can put a mark here. You can make flashcards. Because who knows, you might see this again. You might see this again on your actual test. And you guys know, anything in this book, memorize it, okay? Same here. These questions, as I'm going back and forth, these questions are here for your help. And this is the time to get started, guys. We have an amazing back to school sale that will be lasting until Labor Day, which is September the 6th. So if you want to get started, take advantage of the back to school, have this, get your license in 6 weeks, and begin being a nurse. Okay. And the program right now at remarnurse.com is so reasonable. It is super reasonable for you to purchase this and afford it. Most NCLEX reviews that are literally just questions, you don't get my lectures, you don't get any physical books. They're $300 and $400. They're $300 and $400. This program right now is just $199. It's $199. The link is right there. Just click on it so that you can get studying. Yes, Lydia, this is the time. Okay. All right. So homework. Homework is a very important part of your studying. And like I said, the questions here, there were just 18 questions in this homework. And we talked through most of them. We saw how we need to write extra notes. Look at my homework book. It's filled with notes. If your homework page doesn't look like this, you're not doing it right. You're not doing it right because there's so much information on this one section that you now have mastered. The goal of the entire program is that when you finish this book, all right, and it's not this many pages. It's not this many pages. When you finish this book and you finish this book right here, these two, you are a master nurse. You have content that will not only carry you to pass the NCLEX exam, but in your first year of nursing. All right. It will get you started. You will feel much more confident. And you, most importantly, you won't have to keep failing this exam. The reason why students fail this exam, the number one reason why students fail this exam is because they don't study the right way. They don't study the right way. Somebody tells them all you need to do is do practice questions. Another person tells them just watch free YouTube videos. That's all I did. That's not the right way to pass this exam. This exam is a compilation of everything you learned in nursing school. So if you don't have, just like you learned in nursing school, let me just say this, just like you learned in nursing school, a process of information that builded from the first day of class to your graduation date, you need to have a process that reviews you from the beginning until the end of the test plan. Okay. And that's what I've spent the last 10 years working on. I started this program over 10 years ago, helping nursing students who were difficult test takers. They were international. My first nursing student that I helped was actually from Australia. And I helped her to pass the RN exam. And you guys know how tough that was, right? You guys know how tough that was. They have a different system over there in Australia. I remember her telling me, we don't give patients disposable products in Australia. They come to the hospital and they have to bring their own towels. They have to bring their own washcloths. They have to bring their own soap. They have to bring their own toothbrush and toothpaste. So you guys know how we do it in the hospital. When they come in, they get all that stuff, socks, gowns, everything. And so, what I realized is that if you can make a way easy for a student to learn, okay, if you can make a way easy for a student to learn the information, it doesn't matter where they come from, they can pass this test. And so I created my entire system to take you from point A to point Z in a way that is not overwhelming, that reduces your anxiety, and that helps you to be more successful. Because she had taken that test, my student from Australia, she had taken that test 3 times before she found me. And she passed after studying with me, okay? So this is what I want for all of you guys. If you go through the program is fast enough that if you want to go through it more than one time, you can, okay? Some people are doing my program in 3 weeks. They do these 2 books in 3 weeks, or they do these 2 books in 6 weeks. It's up to you. The Quick Facts has a study calendar. All of my products have study calendars that tell you day by day what you're going to be studying. So if you get overwhelmed, if you're a person that gets overwhelmed when you sit down and you think, oh my goodness, I have so much to do. No, you don't. You just have to do what I wrote down for the day. That's it. And then you can close this book and live your life, because this process can't be so overwhelming that you don't live. Okay. And this also has a 6-week calendar. So make it easy on yourself. Just do the virtual trainer. Okay. Everything will keep you on track. I had such an amazing time checking in with you guys. I don't want to keep you too long because you have your own studying to do. Hopefully going over the homework with me today helps to give you a good boost of what your studying should look like when you sit down with these products. Okay, use them according to the study calendar. Use them together. They work together. They really, really do. And so you absolutely can, will, and must pass NCLEX. I am already envisioning your nursing career. It's amazing. It's amazing. If you need me, don't forget, you can always email me at support@remarreview.com. Support@remarreview.com. Make sure to share this video too. All right, because there are a lot of people who have the virtual trainer and they're not using it to the best of its ability. Okay. This program is very different. It meets you where you are, but it also challenges you. How many people feel like the VT challenges you and it makes you push yourself past what you currently know? And if you feel that the VT is challenging, I see the comments. If you feel that the VT is challenging, then you're doing it correctly. You're doing it correctly. You must pass this exam. You must be a nurse. We need you. We need so many nurses, and a lot of you, we need you immediately. We need you immediately. So come on into the nursing field. All right. This is the time now for you. This is the time. Check out remarnurse.com if you don't have your VT. Get it. What are you waiting for? It's time. It's time. I will see you guys later on, and I hope that you have an amazing week. It's Monday, and we have totally set the tone for focusing in on our goal of passing NCLEX. Later, guys.